Okay, we are going to get started. Just as a reminder, this event is being recorded. So thank you all so much for joining us today. My name is Stephanie Foner, and I work in the Office of Alumni Relations at Northeastern on our Affinity and Domestic Engagement team. So firstly, just a couple housekeeping items. If everyone could make sure your microphones remain on mute throughout the presentation and through the event, that would be so helpful just to make sure that we have good sound quality. I will be keeping an eye on the chat box, so if you have any issues or any questions, please feel free to message me directly. Our speakers will be presenting for about 30 minutes, and then there will be time for Q&A. At that time, please put your questions into the chat box, and I will read your questions out loud. Again, if you want your message or question to remain anonymous, you can just go ahead and message me directly, or you can put it into the full chat box and I will read the questions out loud. This event is being hosted by our Palm Beach community, and I'm now going to give one of our volunteers, parent Hillary Loftus, a moment to introduce herself and to welcome you all.
Okay, there. I hope everybody can hear me.
Yep, you're good.
Okay, great. Good. Well, welcome everyone. I'm so excited to be here with Northeastern family and friends from not only South Florida, but around the country, and our esteemed professors. I remember a few months ago when my colleagues, Tom Donahue and Dan Byron, and I were speaking with Stephanie. We meet about every month and talk about events that we think would be interesting to the Northeastern community. And in normal times, a lot of it has to do with sporting events. But this year, we're needing, all of us need to be more creative. And we'd asked Stephanie if she thought we could talk about how the pandemic has affected all of us, not just our students, but our families and our communities, and if we could have the professor speak. And so she looked into it, and that's how all this came about. And I just like to say Northeastern is a very large school, but it's global, but it's made of so many small communities, and it's got that community feel to it, which I think is wonderful for the students. It was wonderful for my son, Go Huskies 2014. And they have a great way of keeping us all together in community. So I would like to encourage anyone who hasn't been active in the alumni or parent community to reach out. And Tom Donahue has done a great job here in Southeast Florida. You'll hear more about him later. And without further ado, I'm so excited, as I'm sure you all are, looking forward to hearing what our esteemed Northeastern professors have to say and help us with the current situation. Thank you for the opportunity to be here.
Great. Thanks so much, Hillary. It's wonderful to have you join us today. And now I am going to introduce today's speakers. Elisa Lincoln is an interdisciplinary professor of sociology and health sciences and the director of the Institute for Health Equity and Social Justice Research at Northeastern University. She also serves as the Associate Dean of Research for the College of Social Sciences and Humanities. Suzanne Garbarich is the Assistant Program Director of the Institute for Health Equity and Social Justice Research at Northeastern. Her experience is in mental health research and research ethics. And Rachel Rogers is an associate professor in the Department of Applied Psychology at Northeastern, with research interests in the area of body image, disordered eating, and adolescent young adult psychopathology. And now I'm going to turn the floor over to Elisa to begin our presentation.
Hi, everyone. Can you hear me, Stephanie? All right. So First, I really just want to thank Hillary and Stephanie for putting together this discussion today. As you can imagine, those of us who work in public mental health in lots of different ways have been incredibly busy these last 9 months, as this has been a really unique moment for thinking and talking about public mental health. And we really appreciate the opportunity of doing that with this audience today. Um, so, especially Hillary, I think having alums who really want to be invested in this way is really fabulous. And so I just want to say that the group presenting today is an interdisciplinary group. And that is part of the hallmark of the Institute for Health Equity and Social Justice Research. So I myself, as you heard, I'm a sociologist and a public health person. I am not a clinician, but we are lucky enough to have a clinician on the team today, Professor Rachel Rogers, and to have to have Suzanne here as a researcher as well, who I will also say is a proud Husky, having been an alum and received her MPH with us. So I'm going to start by talking about some of the context for within which we will then tell you about two projects that are going on. And so this discussion is a little bit to inform our understanding of mental health during COVID. And then you'll hear about these two specific projects that researchers at Northeastern and at the Institute are engaged in. So with that, I will just start and speak briefly about COVID and mental health. And as I think, Hillary, I think it was you who said it, it impacts all of us. And I think that that's a really important thing to remember when we think about the intersect of COVID and mental health. And so COVID-19 has impacted both population and individual mental health in multiple ways. There's a direct impact of having coronavirus. Many of us probably have friends and family who have tested positive. Many of us may have lost loved ones and family members to COVID-19. And we know that there's a direct impact of having coronavirus on the mental health and well-being of the person working to manage that illness. In addition, many of us are impacted every day by the stress and fear of contracting coronavirus, right? Thinking about even simple things that we probably never provoked anxiety or worry for us that now require us to navigate and think about how do we keep ourselves safe when we go to the grocery store. And I've been thinking a lot about sort of what this moment means for many of us as we think about how to think about stress and fear of contracting the virus and keeping our family members safe during, a holiday season and what that does to stress. And lastly, there's a third way that COVID-19 impacts mental health, which are related to the consequences of measures to combat the virus. So the social distancing associated social, economic, and political impacts that is required for safety has a mental health consequence around isolation as well as many other things. And the last one I think that is on this slide is distrust. And I think in this particular moment in American society, many people are grappling with trust of science, trust of healthcare. What does it mean to engage with a brand new vaccine? And that also is going to be a stressor for many people around mental health and well-being. So before I go on, though, I do just want to make one note about stigma. So as someone who talks about mental health and mental illness all the time, I have a practice of never doing that without acknowledging stigma. And there's a definition up here, the classic definition of Goffman, which is, a stigma is an attribute that is considered deeply discrediting. And we all know what that means in everyday life, right? We don't talk about mental illness the same ways that we talk about physical illness. And there are many more meanings attached to those discussions. But what's been really, I think, compelling during the COVID-19 pandemic is initially there was a very slow response to thinking about mental health during all of this, which makes sense. Everybody was, rushing to try to, really intervene in an acute crisis. But pretty quickly on in the pandemic, people started talking about what they then called the second wave, which was this mental health crisis. Unfortunately, now the second wave has been used for lots of other things. But there is absolutely sort of a huge toll on mental health and behavioral health. And the one thing that I've noticed related to stigma is because there is a common stressor that is something that is clear for both society and individuals, there is a bit of less stigma in discussing the mental health effects. And we know from research, some of which we've done at the Institute, that when people understand a stressor or a traumatic event, the stigma associated with discussing mental illness is reduced. So this is a really important moment for us to really make sure we're talking about mental health and mental well-being and mental illness in ways that are important for all of our communities. So there's a really rich and longstanding sociological literature on stress. I am not going to go into detail. I think many of us are living it every day right now. But I do want to mention a few key points. So one thing that when I teach students, they often find surprising the first time they learn it is that stress is a result from any need to adapt or change. And so that can include both positive and negative events. So, the stress is what comes from that change. So for instance, a life event stress checklist, which is like a checklist you can take to figure out your stress level. I think none of us would want to take it right now. Often includes things like graduating from college, getting married. And so I mention that here because stress is associated with a full range of events. And we know that both individual and societal stresses are linked to a full range of mental health and physical illnesses. So, how do we think about that with COVID-19? COVID-19 is a stressor at both the individual and social level. During an outbreak, we can feel fear, changes in sleep and eating patterns, which we'll hear more about, worsening of chronic health problems, increase in drug and alcohol use. And we have certainly been seeing all of this across many populations. And people who may encounter more stress around COVID include older people and people with chronic disease who are at higher risk for COVID-19, children and teens. Actually, this slide doesn't say early 20s, but as a parent to two early 20 somethings, I've been paying special attention to the literature on that age group. And there's a lot showing that that is a group experiencing tremendous amount of stress right now as well. People who are helping with the response to COVID, like doctors and other healthcare providers or first responders, and also people who had prior mental health conditions, including problems with substance use. And each of these things has a powerful impact on individual and population health. And as you'll see from this list, in addition to the direct effect of the COVID pandemic, we are experiencing these things: economic instability. Many of us have faced unemployment or job insecurity. Many of us have faced housing instability, disrupted social relationships, fear, uncertainty, distrust, and yes, I've already mentioned stigma and discrimination. So apologies for the amount of text on this slide, but I wanted to get the most recent data that I could find. And I'm not going to read all this, but I know the slides will be distributed, so folks will have it with the link. But the CDC and the Morbidity and Mortality Weekly Reports, which are the sort of research that comes out of CDC, has been able to demonstrate quite clearly that we are seeing rising levels of distress and mental health symptoms across all groups. So you'll see here that as early as in April, the percentage of pediatric emergency department visits started to increase, and that has remained higher. Those visits associated with mental health have remained a larger proportion of pediatric emergency department visits since as early as April 2020. And we've also seen reports of poor mental health since as early as June. I think actually probably even before that, but that's probably when we actually had the research that we could publish. So symptoms of anxiety disorder, as you'll see from this slide, have gone up almost threefold. Depressive disorder has gone up almost 4 times compared to the same quarter in last year. Approximately 1 in 10 people have reported that they've started or increased substance use. And there's also been an increase in suicidal ideation, with almost twice as many respondents reporting serious consideration of suicide in the prior 30 days than in the same group in a prior year. And as I mentioned, young adults, Black, Indigenous, and persons of color, essential workers, unpaid caregivers, and those receiving treatment for pre-existing conditions are at increased risk. And it's really important for us to think about who these folks are who had increased risk for psychological distress, especially because it is something that's impacting all of us. And to think about what type of coping can inform how we can think about policies to address health equity and increase resources. And I just wanted to mention telehealth. My guess is, I'm trying to see how many people are on this call right now. My goodness, we have 50, which is wonderful. My guess is if we have 50 people, I'm guessing there's probably more than 50%, about 30 of us who have engaged in some form of telehealth that's particular to behavioral health, mental health, because so many more people are engaging in these resources during this challenging time. So with that, I'm going to hand over to Suzanne Garverick, who's going to tell you about some work we began in April at the Institute for Health Equity and Social Justice Research. And so Suzanne, I will hand over to you and mute myself.
Great, thank you. First of all, I'm just really happy to be here today and be part of this discussion. I think it's an important discussion. As you know, we've talked about mental health really impacts everyone, and especially around COVID-19, it's impacting everyone right now. So just a little background of this study. So Elisa, you could forward the slide, that would be great. When the quarantine and isolation policy started to take effect in March, there was a team of researchers that that came together and really wanted to understand the impact these policies, well, not only the impact COVID-19 was having, but also these policies were having on people, particularly people living with mental illness. And we really wanted to do this because we wanted to work with, or we wanted to partner with our community organizations that were dealing with people who support people living with mental illness, to help to identify ways in which we could best support people living with mental illness. So we developed a survey that went out to Massachusetts mental health organizations. A few of them were NAMI, the Department of Mental Health, Depression Bipolar Support Alliance, as well as some peer-run and peer specialist organizations. And we started this in April of 2020. We really wanted, again, to learn about the impacts COVID-19 and related policies were having on people either living with a mental illness or receiving mental health services. So in this first round of sending out the survey, we had 70 participants complete the survey. And I just want to note that this was also in the beginning of the pandemic. So we had people fill out the survey between, I believe, April and June. So this really was the beginning impacts, just the beginning impacts of COVID. So you'll see from this slide the demographics of the participants. As you can see, participants have high levels of education. They're less financially burdened as they report being employed and housing stable at this time. They also reported having primarily pretty good health, overall fair, good, and very good physical health. So when looking at this data, we really want to look at it as being the best possible case scenario for people living with mental illness during COVID. And what we know from our data thus far is that people's mental health is being severely impacted, even in the best case scenario. So really want to frame it that way. So our survey had several quantitative scales to assess the impact the pandemic was having on participants' mental health. We looked at COVID-19, the impact COVID-19 had on PTSD symptoms, stress, substance use, as well as loneliness and overall mental health. So about 85% of the participants indicated their lives had been disrupted some or a lot by the pandemic, in comparison to 40% of adults in the general population, which was reported from a Kaiser Family Foundation survey that was done around this time. Also, 72% of our participants indicated that worry or stress related to coronavirus had had a negative impact on their mental health. And this can be compared to the general US population, where 45% of adults reported the pandemic having negative impact on their mental health. So also, the majority of the 72 participants indicating that coronavirus related stress or worry negatively impacted their mental health reported that this was a major impact on their lives. So next slide, please. So along with this quantitative data, we also asked several open-ended questions to really understand and get a better understanding about the impact COVID-19 was having on our participants. So I pulled out a couple of quotes that really show the impact COVID-19 and the quarantining policy were having on people. This first person stated, "The pandemic has felt all-encompassing, to the point where I feel that it touches every part of our lives in a negative way. I've also felt overwhelmed and anxious to the point of causing physiological symptoms. Next slide, please. So this next quote illustrates how the quarantine and isolation has impacted people's lives. For years, I have learned to control and have controlled my depression and PTSD by getting out into the community for several hours every morning. I went to see friends who worked at a coffee shop, as well as being around other people. This also helped structure my day and got it off to a positive start. Now I have no structure, and while I'm trying to come up with one, I haven't yet succeeded. Next slide, please. So this participant specifically talks about how the loneliness and isolation has an impact on her. So she states, yes, I have eaten more for comfort, gained a lot of weight. My blood pressure went up a lot from stress, had to increase meds for it. Isolation, very painful at times, caused feelings of anxiety, hopelessness, anger, and recklessness. Next slide, please. So as seen by both the quantitative and the quotes that I just read, participants reported high levels of disruption to their lives and mental health due to the pandemic early on. So we also asked questions about the impact COVID-19 had on participants' wellness activities. So about 62% of the participants reported some or a lot of changes in their ability to access and participate in wellness activities due to the pandemic. When asked how COVID-19 impacted their wellness activities in an open-ended questions, many people not only included the things that they couldn't do anymore, like going to the gym or physically socializing, they also included ways they have adapted and created new wellness activities, showing the amazing resiliency of these participants. So this resiliency is also backed up by the quantitative data where people scored high on the resilient coping scale, which illustrates higher levels of resiliency. And so I pulled out 3 quotes that really show the resiliency of our participants. So this first participant said, because of my disability, I used to swim 2 times a week for safe exercise. Now that the weather has changed, I will be doing some vegetable gardening in the backyard, stretching, walking our dogs around the backyard. The second participant said, I have been using my meditation app more because I have the time. And this third quote is, due to the pandemic canceling my plans, I've had more time to join fitness classes virtually and watch cooking videos online. So I just think this was amazing that people just were really reaching out and using skills that they developed to really keep continuing to take care of themselves, even when their old coping skills weren't, or strategies weren't allowable anymore because of the quarantine due to COVID. So people's resiliency is extended to self-care activities they were engaging in. And in the last question, we asked them if they had some suggestions or tips into how to take care of themselves or for other people to know. And so they're really skilled in knowing how to take care of themselves and had an array of tips. And I just want to list a few because I think we all can get some ideas from them. I mean, I know I did, and I do some of these things now to really help me during the pandemic. So our participants said to exercise, take walks, keep a daily routine, start a project or a hobby, listen to music, read, meditate, pray, relax, stay busy or distracted, and engage socially via technology. So just to wrap up, I just wanted to, so we would really like to expand our research in this area and to get more people surveyed and especially understand the impact, the longer term impact COVID-19 and these quarantine and isolation policies are having on people. So we want to, we're looking into applying to grant mechanisms in order for us to better understand this impact and to better be able to support those people living with mental illness in a time of a pandemic. So now I would like to turn it over to Dr. Rachel Rogers.
Thank you. And I would like to start by echoing my thanks for having invited me to join this event and again, how much I believe that this is such an important topic and that it's really important to emphasize how this affects everybody in these difficult times. So as Dr. Lincoln was describing in her lovely introduction, some groups have been differently affected by the conditions that have been imposed by the social restrictions and the different things going on with the virus. And one important group has been parents of young children, particularly parents who have not been able to access childcare during these times, and therefore who have found their family lives and often their professional lives to be extremely disrupted by these things. And one of the areas that we are very interested in terms of behavioral and mental health is eating patterns. And parents play an extremely important role in this, as they are often the main providers of food and meals for young children, and that they have an important influence on the way that children's eating patterns and preferences develop, not only through the ways that they introduce foods and organize meals and eating patterns in their house, but also through the eating behaviors that they themselves engage in, that are then modeled for children who kind of watch and learn and pick some of these up. So we were very interested in learning about how eating and feeding had changed due to these disruptions in mums and young children. And similarly to what Suzanne was describing, we were also interested in approaching this from a strengths-based framework and thinking about how there might be some things that were more difficult, but that there also might have been some unexpected things that were going well, and what we could learn from that. So this was a study that we launched about at the same time as the one you have just heard about. And we recruited mums who had children under the age of 5. So some of these were breastfeeding, 44 of them. Another 63 had children under the ages of 2 who had started eating solids. And then the majority of them had children who were aged between 2 and 5. Thank you, we can move forward. So we asked them some quantitative questions about feeding using scales that are employed to assess those constructs. But similarly, we had some open-ended questions. I think that this was where some of the really rich data emerged. So first of all, we were asking parents about how the differences and the changes in circumstances had affected their own eating behaviors. And a number of parents had things to say about how the circumstances have been difficult for them and how they perceive them to have had a negative impact on their own eating behaviors. And this included things like more binge eating, eating when upset, nervous eating, more stress eating, more cravings for sugar, eating more chocolate, much more chocolate. Other people highlighted binge eating and things that were thought of by participants as not being a healthy eating pattern and demonstrating a lack of self-control. However, people also described, if we can move forward, some more positive things. So some parents described that they were eating more home-cooked foods, eating complete meals, trying to waste less, and so eating more leftovers. This is a really interesting statement from a perspective of food sustainability. And we actually had a different study that was looking at some international data on changes related to eating patterns during the pandemic. And food waste is something that has come up as a really interesting variable. People described cooking more, being creative with meals. Fast food or readily prepared food was much harder to access, and so people weren't eating so much of that. They were cooking meals, they were using ingredients that they already had. They were eating less meat, which also from a social justice and sustainability lens regarding eating is an interesting perspective. And that people had more time to prepare meals and sit with their family to eat them. And that's important because we know that having time to sit with children to eat is one of the factors that actually protects them from eating difficulties later on in their teenage years. And so this was a really positive thing. If we can move forward. Thank you. So then we asked parents what they had noticed about their children's eating patterns. And here again, there were some more difficult and challenging things, and then some more positive things. So one of the challenges identified was children wanting more snacks, eating more snacks, wanting snacks constantly, eating out of boredom, many more snacks, that meal times and structures were disrupted, that they were less cooperative at meals, that they threw food around and didn't participate in meals in a constructive way, and that even babies had been fussier when eating. But again, there were some positives. Thank you. Parents noted that children were eating better breakfasts because of there being more time and less stress in the mornings, that they had been listening and wasting less food, that it had been an opportunity to try out solids for children who were in that developmental stage, and that parents had had time to experiment with purees and different types of foods, that they had been feeding their children more fresh foods or able to breastfeed them more because they were at home all the time. More variety, more fresh fruit than might be available at school, in fact. And that in some families, there really was a structure of eating 3 meals together every day, and so much more family time. So those were some really interesting findings in terms of eating patterns and how they change. And again, I think really echo the previous results that we were hearing about in terms of how some groups are really vulnerable, and that pre-existing concerns, for example, binge eating is rarely something that just emerges. It's often something that has been underlying and that may pop up again in times of increased difficulty and stress. And at the same time, how there is growth and how people can self-reflect upon things that have been positive and unexpected things that have come out of difficult circumstances. So that was some of our research around eating. As Dr. Lincoln was mentioning, I'm faculty in the Department of Applied Psychology, and we are interested broadly in mental health and how different circumstances in the environment impact mental health. And something that we thought it would be interesting to mention in this talk, firstly, because of its timing, and secondly, because this is something that has come up as we've been talking about these issues in other forums, is the way that stress may occur now or in the coming months as things seemingly improve. And again, Dr. Lincoln was saying stress can occur from events, whatever their valence. And indeed, often an event can have a number of different valences depending on exactly which point in that event or who is perceiving it. And so I'd like to take a few moments just to talk about anticipatory stress and anxieties that may emerge just at the point when vaccines are happening, and perhaps in some places rates of infections are decreasing. If we can move forward. Thank you. So as we've been talking about, anxiety increases in times of uncertainty and change, whether this be happy change or less agreeable change. And I think a really important point is that this is to be expected. It happens for a very good reason. It is a normal physiological and psychological process, and it's often very useful from an adaptive perspective because it helps us to prepare. However, it is less useful when this reaches a level where it becomes impairing or overwhelming. Right? There is a curve and there's a sweet spot, and up to a certain point, this can be helpful, and then it becomes less helpful. If we can move forward. Never mind. I thought there was a little more, but that's fine. I will just speak to it. So when there is a sense that anxiety is perhaps reaching past that sweet spot and to a point where it is less helpful, from a behavioral health perspective, there are a couple of things that we can think about that can be useful. The first thing is, I think, just acknowledging the fact that this is a normal process and really trying to enter into it from a perspective of something that is to be expected, that is probably happening to most people in these circumstances, and that shouldn't be met with as if it was something that was unwelcome, but more kind of just accepted and seen as something that is bound to happen. There's also a number of behavioral strategies that can really help to regulate these periods of increased anxiety, such as keeping to regular eating and sleeping and exercising patterns, engaging with some of those mindfulness and emotional regulation strategies that the participants in the previous study were describing. And social support. Now, I know that in times of social distancing, social support can be a little more difficult to access, but I think one of the great benefits of telehealth and our abilities to connect via internet is that there are ways in which that social support can be accessed. It can be counterintuitive in that in times of increased anxiety, sometimes that is when we're least able to engage with our social support, and yet that is when it's most useful to make that effort. And finally, of course, if the levels of anxiety really do seem to be impairing, then it can be very important to overcome any stigma, as Dr. Lincoln was describing, and avail oneself of the resources that there are from professional health providers. There are a lot of resources around anxiety, many of which can be readily accessed, and of course, other forms of more professional support. And speaking of which, here are some general mental health resources that we thought it might be helpful to include just here. And I'm wondering if we might leave this slide up as we start our discussion, just in case anyone wants to kind of take the time to make a note of any of these. Thank you.
Great. Thank you so much for sharing. We are going to start the Q&A portion. Oh, and I will also say that these resources will be listed in a follow-up email that you will all be receiving after the event that will include a survey, and it will also include these resources so you can have them there as well. If anyone has any questions, please go ahead and start populating the chat box. Again, I'm happy to accept private messages if you'd prefer, that's totally fine. Or you can go ahead and put them in the general chat box. So we have our first question, and that is, there's been a lot of attention towards how kids are affected by mask wearing socially and emotionally. Why do you think this wasn't happening during SARS in 2002 through 2004, which was also a mask wearing pandemic? And do you think that it could possibly be because social emotional learning was not as prominent of a discussion or topic back then? Or is it possible that there's a difference between the fact that at that point it was primarily widespread in Asia, and now we're seeing data from kind of across the world? I don't know if this is within anyone's wheelhouse, so I'll just put it out to the whole group.
I mean, it's not an area of expertise, but I can give a few thoughts. First of all, I think the comment is so thoughtful that there's a lot of answers in it itself. And that, yes, it's likely that all those things are factors. And what a wonderful question. I think that there are certainly sociocultural differences in the way that people tend to wear masks. If you think of places in Asia, it's common practice to wear masks at particular times of year, or when having a cold or something. And so the impact of being asked to wear one is probably different if it's something that's more socially acceptable. I think also that being asked to wear a mask as a child when there is so much social disruption probably also increases the impact of it, and that therefore what we're seeing here might just be a reflection of an accumulation of different factors, perhaps in addition to the specificness of the mask itself.
Okay, great, thank you. Not to wade into too political of a territory, but with all of the current events also going on with COVID and the kind of political posturing around prevention measures, are you seeing children or adults being concerned with current events and kind of COVID's place within the larger world we see ourselves in right now.
Yeah, I think I can take a stab at that one. What I would say is that this has absolutely been a 9-month period where there has been all sorts of disruption occurring at the same social disruption at the same time as the COVID pandemic. And so whether it is sort of increased attention again to Black Lives Matter movement, anti-racist movement, the murders of Black men and women over the summer, and the social unrest and righteous anger response that followed. I heard you say at the beginning, we're trying not to go too political. So as a sociologist, I'm like trying to rein it in a little bit. But the reality is, right, this global pandemic has occurred during a time of lots of other social unrest as well. And I don't think you can really fully disentangle that, especially because of the ways, as a public health person, right, wearing the other hat I wear, the politicization of the mask in this country is very different than the sort of cultures that Rachel was just discussing around mask wearing. And I think we're going to learn a lot over in the future about the ways mask wearing was politicized in this country, and what those forces were, and the ways that has mattered for a full range of physical and mental health outcomes. So I hope that answers that question.
Yes, absolutely. Okay, are there any tips to offer young adults and adults who are experiencing COVID fatigue around wearing masks and socially distancing, especially when we're getting so many messages these days that the vaccine is coming right around the corner and the end is in sight? Although we still obviously need to keep protecting ourselves. How can we make sure that that people are still protecting themselves in this time?
So, I'll go ahead, Suzanne. You look like you had a thought. Nope. So I will say that I think as a public health person, I've just been doing a lot of speaking about one day at a time and trying to just remember to do this today. And I think I will say also as a person, for me, that helps with some of the fatigue. When I don't think about how long I've been wearing the mask and how long it's been since I've hugged my parents, and I don't think about how long it might be, I do better that day. When I just focus on today, this is what I need to do. So, I will say that, and as much as the vaccine is absolutely in sight, clearly, right? It was administered, I believe, yesterday in England. It is going to be a while until we're safe again in the ways that I think a lot of us are just craving physically and emotionally. And certainly sitting here in Boston right now, looking at the numbers, these are some very, very difficult days. So there is that holding, for me, and I think the many people I've been talking to, it's kind of holding two realities, that there is that light at the end of the tunnel, but we really can't, this is not the moment to ease up on all of our protective measures. And Rachel, I'm curious if you have other thoughts from a more clinical perspective.
I think that what you say makes a lot of sense. And I'm seeing there's some other questions in the chat that also talk about a longer tunnel and kind of whether it is a return to where we were previously or whether it is also moving towards a different place. And I think that holding, that dialectic is very much the case. I think it's also, certainly for me, reassuring to know that while it always seems that what is good and what one needs is what we knew before, actually, we are extremely adaptable. And that, the way that the mask feels today is not going to be the way the mask feels tomorrow or in a month, even if it is still there or if it's there differently, that this, any situation will feel different.
Absolutely.
I think that's actually a good segue into the next question. Is there anything that could have been done earlier on in the pandemic to mitigate some of the negative effects that we're seeing on mental health I know on the physical health side, the recommendations had changed from day one to now. So any thoughts on what maybe could have been done at the outset to mitigate some of these issues that showed up in the survey responses?
Oh, an interesting question. Suzanne, I want to ask you, since you're most familiar with our survey
Yeah, so
responses, if you have thoughts.
I would just say acknowledging that this could have a mental health impact. Like, no one wanted to talk about it at first because of the stigma of mental health. No one wants to be impacted and have mental health issues. And someone we so do in our society. We just don't want to talk about them. So I think just having people talk about them and educate people about them and normalize them would have gone a long way in helping people to address the anxiety and the stress, and they don't understand what it is and why it's happening.
Yeah, I think that's right. And I think also at a more macro policy level, I think we need, we have been forced as a society to look at the ways we have handled or structured or supported childcare, how we have thought about eviction policy, how we have thought about unemployment policy. Certainly some of the mental health impact of this pandemic in the US is very tightly linked to larger societal policy decisions. And you see that very clearly when you look internationally at rates of housing instability, homelessness, people who have lost their job. That is not a one-to-one correlation with a pandemic. That is a reflection of our societal structures. And there's another project I'm working on with two colleagues, one from the business school and another, an economist, looking at how families have been impacted by COVID, choices about employment, choices about childcare. So I do think we would be in a different place societally or with population mental health if we had had different policies in place from the beginning.
Great. So much of this conversation has centered around stress and stress management. What is around the COVID stuff? But is there also a larger impact around stress in everyday decision making? Even the most basic decisions like going to the grocery store were once a non-issue, but with COVID are now really layered and deeper decisions.
I can take a step at that.
Yeah, go ahead.
I think that's such a wonderful point, because one of the things that increases stress is having to relearn everything. Mm-hmm. And in many ways, living with these restrictions and social distancing rules, it's been a bit like moving to a foreign country where everything needs to be relearned, where usual social cues are absent, where you have to understand the local culture and what can be done, what can't be done, etc. And that is extremely stressful. Again, it doesn't have to be a negative way. If it's an exciting opportunity of moving to a new place, this usually isn't experienced like that. But it does incrementally add to the stress, in that things that used to be a habit, that used to be something that could be done on autopilot, now indeed incur a number of decisions. Even if they're not stressful, they're things that have to be decided. And that just increases the mental load and the stress on everybody. Great point.
I've also been learning about this new term to me. Dr. Rogers might know this term, but decision fatigue, where people are, the more decisions you have to make, the more tired you get making them, and the less you make the appropriate decision. Nice. So I think that's really happening.
Absolutely.
Yeah.
If you feel comfortable speaking to this, we do have a comment that one of our participants has noticed an increase in their classmates withdrawing and dropping classes, taking medical leave, or filing incompletes. Have you seen firsthand the impact that this time is having on students at Northeastern?
That's a really important question. I'm actually not teaching right now, but I work with many students, and I will say that they, like all of us, are feeling the impacts of this, right? And if you think about when I talk about college mental health, which I do in some other forums, if you think about what it means to go off to college your freshman year, you leave your home with your social support networks, you go somewhere where you're going to have disrupted sleep patterns, you're going to have increased access to drugs and alcohol, you're going to, it's a perfect storm for challenging someone's mental health and well-being to be in a college setting. I do think this is having a really large impact on many of the students I work with. And, so I can't speak as much to the withdrawals, but from courses. But, I do think one thing I've been very proud of at Northeastern are the many ways that we have come together as a community and tried to step up to support students, but also staff and faculty. Thank you, Dr. Rogers. This has been fabulous. Speaking of students, go and please teach our students. Right. But, I have never felt prouder of our Northeastern community and the ways that we've come together to try to support each other. And sometimes that happens physically on campus and sometimes that happens virtually. So I hope that sort of answers the question. So yes, seeing the effect, but also seeing a lot of students also stepping up to support each other, which has been really fabulous.
Great. Let's see. So we have time for one more question that I'm going to share. As it is unlikely that we will be getting back to full density in social situations, and we're only kind of one virus away from this time setting in again, how do we get comfortable with evaluating risks? So we can broaden this to just the risks that we will be encountering in the world as we venture out again.
Another really important question, and I'm actually going to link it to another question I've seen here about healthcare workers, right? So another area of sociology that intersects with health is the sociology of risk. And we know that different people and different people's background and lived experience impacts the way they understand and interpret risk. And so, if we think about healthcare workers, many of us have friends and colleagues and loved ones who have been out there every day absorbing risk during this. Others have had to absorb less risk. I actually don't know the answer to how we get comfortable with evaluating risk for large crowd situations. I think that's part of the re-entry that Dr. Rogers was talking about and how we navigate that. I wish I had a better answer for you. I think it is going to be an anxiety-provoking time for many of us as we enter. And, there have been large increases in PTSD symptoms, not just among healthcare workers, but frontline grocery store workers. And this again links back to one of the earlier questions around the other events in the past 9 months and racial injustice, right? That the same communities that have been disproportionately impacted by the COVID pandemic, both COVID cases and mental health impact, communities of color have been facing lots of other stressors as well. So I think there's a lot of work to be done. I think there are many strengths we can build on. We've learned a lot in the last 9 months, both at an individual and societal level. And I think there's a lot of good work that can be done going forward to support people's mental health and well-being. But just the fact that this conversation is happening, right? That an alumni association says, hey, let's talk about mental health and well-being. I think that's a really important step and helps in many ways.
Yeah, I just want to add that I think it's when assessing risk, I think it's really important I'm going to speak for me. This is how I assess risk. Like I look at the science and then I also figure out what's okay for me. I think assessing risk is, as Elisa was saying, Dr. Lincoln was saying, was that it's going to be on an individual basis and depending on that individual and being okay with if you feel like something's risky and not doing it and that's okay.
Well, thank you so much again. I'd like to just take the last few minutes. In addition to Hillary, we are lucky today to be joined by two other of our community volunteers from Palm Beach, Tom Donahue and Dan Byron. Tom Donahue, our volunteer leader, is just going to close us out by sharing a few words about the Palm Beach community and engaging with your Northeastern community wherever you might be.
Great. Thank you, Stephanie. Can you hear me okay?
Yep, you're good.
Great. Well, it's a cool day in down here by Florida standards. So along with this event, gave me a rare opportunity to break out my Northeastern hockey jersey. That doesn't happen often. I definitely want to thank everybody who put together today's presentation. I work for a prominent engineering firm in South Florida, and we lost one of our best and brightest young engineers in May to COVID. So it was difficult for us to learn on the fly how to deal with our staff, how to monitor their feelings, and how to adjust. So I certainly appreciate this presentation. I've been involved with the Alumni Association my whole 17 years since I've been down in Florida. We have about 5,000 alumni spread over Miami-Dade, Broward, and Palm Beach County. And it's been an incredible experience getting to know our alumni of all ages and learning the incredible things that they've accomplished in their careers and in their personal lives. And they're just a great group of people. And I encourage you all to continue to get involved with your local communities. Keep an eye out for the postings that the alumni office sends out on events. And if you see one, if you know other alumni, share it with them. Don't assume that everybody is looking at them. And that personal touch helps a lot. Over the years, I've put together, I built a contact list of about 400 alumni that I've dealt with over the years, so that when the alumni office sends out their event notices, I'll follow it up with one from me to give it a little more personal and local touch. In South Florida, you can also join us on Facebook by searching for Northeastern University Alumni South Florida and join there, and you can see photos from all of our events over the years. The Naples community also shares and posts to that website, so you'll get a feel of things going on both the east and west coast of Florida. So I hope you join us in South Florida if you're down here, or be active in your local community. And in the meantime, stay safe, stay healthy, happy holidays, the best to all in the new year, and go Huskies.
Thanks so much, Tom. Thank you everyone for joining. Hope to see you soon, virtually.